Hey, deserving listeners, time for me to continue watching John Oliver talk about mental health care. I'm really enjoying this. Let's watch. My name is Dr. Kirk Honda. I'm a therapist and professor. Let's see what they say.
Which is absolutely pathetic. And it is not just private insurers that are a nightmare here. Community mental health clinics, which often serve low-income patients, are suffering as well because the reimbursement rates for public insurance like Medicare and Medicaid are also woefully insufficient.
Yeah, way worse, actually. And like I was saying in a previous video, that when you work at a community mental health agency, you're being paid very little, and a huge part of that is because the government medical insurance reimburses very little money.
Basically, from top to bottom, we significantly underpay mental health professionals, many of whom do difficult, high burnout work. It is no wonder.
Yeah, I'm glad he brings that up as well. So, ironically, the people that are doing maybe the most good, people working in community mental health agencies, they have 35 clients a week, 35 hours of clients a week. They're working with people with multiple problems going on in their lives and their families, multiple diagnoses, multiple contextual problems, racism, economic problems, health problems. And these clinicians are helping tremendously because there's so much to help. So there's a lot of improvement that can happen with these people because there's so many problems. And they're working, and they're being paid very little, and their burnout rate is so high because of the client load and because they're not being paid a lot and because the clients are so difficult. When you actually get enough experience and you become fully licensed and you get a little bit more established, you leave community mental health and go into private practice because then you can make 5 times as much more money, 10 times as much more money, actually start paying off your student loans, start to be able to afford maybe a bigger apartment in Seattle, not the tiny little place that you're renting with 5 other people. So there's a lot of reasons why people will leave those community mental health agencies and go into private practice. And it's backwards, right? The people that are in community mental health agencies, they should be getting paid top dollar because they're doing the hardest work. People in private practice should be paid the littlest because it's easier relative to that. Now, I would say leave the private practice salaries fine because, like I said, those people are not living in big mansions. They're living very modestly. And then what we need to do is you need to raise taxes and allocate that money for a lot of things, including paying community mental health agencies and Medicaid, Medicare, those kinds of people, 10 times as much more money. Because not only would they be able to pay their people a commensurate salary with what they're doing, but you'd also be able to hire a lot more clinicians.
And the thing is, some out-of-network therapists can make a lot of money if they live in an area with patients that can afford to pay out of pocket. But for the many who don't, they are stuck taking whatever insurance companies are willing to pay.
Right, I'm glad he's bringing that up as well. And that is a privilege here in Seattle. I was saying earlier that the median house in Seattle is, $850,000, $900,000. So it's expensive, cost of living, so you charge more in Seattle potentially. And you also have a lot of people working in Seattle that can afford to pay out of pocket, they don't have to go through their insurance to get the therapy that they want. There's a lot more people in Seattle that are along those lines. So it is a privilege here in Seattle along those lines. But of course, there are people in Seattle who can't afford it and are stuck. And then you have other communities where there isn't as much money kind of swirling around, and you might not have anyone in that community. If you're a therapist working in a community that doesn't have a lot of rich people, you as a therapist might completely depend on the insurance companies to provide you with clients so that you can actually make a living and so that people can have the services that they want. And so, yeah, that is a problem. And again, just think about that issue that in Seattle, you have a lot of people who say when they go to the doctor, insurance pays for it. But because their mental health coverage with their insurance is so weird or bad, they pay out of pocket even though they're paying for insurance, right? But because they're rich enough, they can actually do that, right? It's like paying for your own surgery or something, right? Or you go to the ER because you broke your arm and you just pay out of pocket. That's essentially what clients are doing in a lot of communities, which is just ridiculous.
Which helps explain why psychiatry was ranked one of the lowest in compensation among 29 medical specialties. And it's not just doctors, counselors and social workers with masters.
Right. So just to give you a little bit more context on that. So among the different specialties in psychiatry, they're saying that it is one of the lowest reimbursed, meaning that when insurance companies pay per hour of service, psychiatry isn't paid very much compared to other kinds of medical services. And so if you're a psychiatrist, the only way you can make a living that is commensurate with what you feel like you should be earning is you have to cram as many patients into your hour. So you have to see patients for shorter and shorter amounts of time. And then you can actually make enough money to pay for your office and your reception people and your billing people and your student loans and actually have a somewhat comfortable life. Like, that's the reality. So if you actually forced insurance companies, or better yet, had a government system that actually paid psychiatry at the level that it should be paid, then psychiatrists would be able to take on far fewer clients, and also there'd be more psychiatrists that would enter the field because they're being paid sufficiently. And then as a patient, when you go in to a psychiatrist, they could take their time, because psychiatrists want to, is the thing. Psychiatrists don't want to cram 10 clients into an hour. They want to take a lot of time. That's what they got in. They didn't get into this industry to turn the clients and the patients as fast as they can. They got into this industry because they wanted to help human beings. And in order to help human beings, they have to get to know them. And that's what they want to do. And so if we actually paid for those services and allowed the clinicians to do that, then that's what they would do.
They are stuck taking whatever insurance companies are willing to pay, which helps explain why psychiatry was ranked one of the lowest in compensation among 29 medical specialties. And it's not just doctors. Counsellors and social workers with master's degrees earn 33 to 45% less than other health professionals with a comparable education.
Right, exactly. So when you become a counselor, marriage and family therapist, social worker with a master's degree, that takes about 3 to 4 years of graduate school. That's in addition to 4 to 5 years of your bachelor's degree. So if you have a master's degree today, typically you have at least 7 years of college. When you compare that level of education to other professionals, you typically will earn a lot less, a third to almost a half as less money. And why is that? Well, because we don't pay these people enough. And a big part of that is because you don't have a government that will uphold fairness for those kinds of services. And you have a society that doesn't necessarily value it, right? If we have a shortage of clinicians, which is clear, then this is one of the ways that you could change it. If you just pay clinicians more, then it'll attract more people to be in the field.
And if we continue at that rate, one day we're going to wind up with negative therapists, which I'm pretty sure is what you call anyone who responds to your serious mental health issues with, interesting, I can't wait to get into my jammies later.
Yeah, another thing I want to say on this topic is that you might even be thinking this, that, well, aren't therapists supposed to be trying to help society? Why would they leave a community mental health agency and go into private practice and only service the rich people, right? Well, the problem is that, like I've been saying, in order just to pay your student loans back, working at a community mental health agency is probably not conducive to that. It might be, and things are getting better in some agencies where they might actually start paying more, or I don't know, if you stick around long enough, you get raises. There are plenty of people who stay in community mental health agencies their entire career, and they do fine. There's a total benefit to that. You get sick pay and vacation, and you get your benefits and all that kind of stuff. And you stay in touch with colleagues, and it's a dynamic environment. You get a lot of personal fulfillment working with people in need, that kind of thing. So I'm not saying that everyone flees a community mental health agency. That's just not true. But generally, on average, that's what happens. So one of the things that happens is, because the vast majority of therapists, I would venture to say 99% of therapists, they're such bleeding hearts that they know that. It's like, wait, I'm leaving the underprivileged and I'm going into private practice for my own greed, so that because I want to be able to pay my own bills and buy a car that actually runs, that actually works. Is that selfish of me to do that? And as a supervisor and as a mentor, I'm like, no, it's not your fault as a therapist, as a novice therapist, that the system is screwed up. The system is screwed up and everyone is suffering, and you don't have to suffer. If you have to make this move and unfortunately leave the underprivileged people and start working for people that are more privileged so you can pay your bills, well, then that's what you got to do. It's not your fault. Let's all try to vote. Let's try to advocate. Let's try to change the system. Then what they'll frequently say is, okay, well, maybe I'll do pro bono. I'll do free services to some clients, right? And I'll tell them, well, if you want to, but how about you leave that up to us? As seasoned clinicians, we have our practices established and we are doing better in life. We're maybe charging more. Seasoned, experienced clinicians that are further in their career, they should be the one providing free services, not novice clinicians that are still going in the hole regarding student debt. So that's what I tell my recent grads. And without me there, a lot of my supervisees would have listened, and they'll even be professors that will say this. It's just like, don't go into private practice because that's selfish and greedy. And I'm just like, you're blaming the victim kind of in that situation.
Mental health problems are a big driver of homelessness and also force people into contact with the criminal justice system. In fact, it is often said that correctional facilities have become the largest providers of mental health care services in our country. Basically, we've gone from warehousing people with mental illness in buildings that felt like prisons to warehousing them in actual prisons instead.
Yeah, this has been a well-known phenomenon for decades. We've been saying this for decades as therapists and researchers. We've been trying to get it to be changed, and very little of it has changed. And the experts, such as myself, have been saying it's all about money. You have to spend the service, you have to allocate the taxes to pay for the services. And I hope he says that, because he's been kind of alerting of the problems, which is really good. But I hope in the conclusion he says something like, there must be a raising of taxes and allocating of those taxes. That's the only way out of this. I often emphasize that because I hear a lot of people, even people in my field, that will be advocating. It's like, we need more services. We need more services. And I'm like, okay, when you say that to people, they will think, oh, well, we just have to yell at the insurance companies, or we just have to yell at the system or something. Well, the insurance companies are making profits, and they're doing things within their legal rights to do. The agencies and the clinicians, they're full, and they're just doing what they can. The problem is money. It's all about money, funds. We need billions of dollars to be allocated to this, and the only organization that has that money at the ready is the government, often the federal government. So until we get the government to raise those taxes or allocate those taxes to this problem, it's just going to continue. And I've been yelling about this for 20 plus years. And every time it comes up, people say, they get up in arms. But then when it comes down to actually voting, or it comes down to actually paying taxes, people don't want to do it. And so I'm extremely discouraged. Now, maybe this video will help, but I'm not super optimistic, honestly. I hate to be a bummer, but I've been ranting about this for 20 plus years. So, and it's getting worse to some extent. I don't know the stats, but this phenomenon of putting people. So John Oliver said you could kind of think of prisons as the primary mental health care provider. It's not metaphorical. It's truthful that the prison system is the highest provider of mental health services.
It's very much the new look, same great taste of America's failures. So how do we fix all of this? Well, first, this is clearly an absurd way to operate a healthcare system. And for the umpteenth time, I would argue single-payer healthcare is the way to go. Unfortunately...
Yes, but if you don't have the funds for that, then it wouldn't matter anyway. Because if you said, okay, the government is now going to have a single-payer, insurance system, it would end up looking like Medicaid, where most of the services wouldn't be paid for, and it would be paid for very dismally, not a lot of money, and you would end up with a very similar situation where you have a lot of people that can't find a therapist, and the only people they can actually find are people in private practice that charge a lot of money, and so only the rich people can afford, and even those people are full. And so a single payer system would help for sure. I mean, there's things that you could do to regulate the pricing and all that kind of thing. And maybe by extension, John Oliver is saying, well, then you'd also be able to allocate tax dollars to reimburse the people accordingly, and you wouldn't have to use regulations to monitor all the insurance companies, which would be a plus. But again, I hope he says raising taxes.
We can't get that because it's very high up on a shelf. I don't know who left it there, but they must have been tall because it's way too high to reach. And if you're thinking, why not use a ladder? The ladder's also on the shelf. It's a really frustrating...
He's using a metaphor to say that government red tape and misinformation and echo chambers make it so that it's almost impossible to actually achieve something that the vast majority of other nations have achieved in a rational fashion decades ago.
But in the absence of that, we need to both recruit more mental health care professionals and make sure that insurers cover them properly. Now, on the first point, the Biden administration, to its credit, announced a plan back in March that would provide $100 billion in mandatory funding over 10 years to compete.
That's nothing. I don't know exactly how the math works out. I mean, it's something, but $100 billion in mandatory funding over 10 years, that's $10 billion a year. That's nothing. That'll do something, but it's not enough. Okay, so back of the napkin calculation, if we take $10 billion, so $100 billion over 10 years, so it's $10 billion a year, and you divide it by the US population, which is about 330 million, and you say, well, maybe 1 in 10 people would need access to those funds, you have about $300 per person. 1 out of 10 Americans who might need healthcare and are not able to get it for one reason or another, we're allocating $300 to that individual for the entire year, which is nice, but we need a lot more money, and the US government has a lot more money to spare. And you could raise taxes, and you could tax the rich more.
Completely transform our current system, which includes investing $700 million in programs to cover everything from training to scholarships and loan repayments for those committed to working in underserved areas.
Okay, that's nice. Again, $700 million, it's not a lot. Sounds like a lot, but when you spread it out over the thousands of people that would need that money, it's not a lot, but it's something. And it funds people, incentivizes people working in more rural communities. They'll pay off their student loans. Okay. I mean, probably not their entire student loan, but, and our government already does this, by the way, to some extent. So it's just adding more funds to it. But again, imagine if we actually allocated a substantial commensurate amount of money to this. That'd be nice.
We have to respect and value mental health care. And that means supporting the people who deliver it. Look, it's going to take a lot of investment and continued resolve to fix things, but it's also absolutely worth it. Because it just cannot be the case that when people ask for help, our only option is to tell them to suck it up, buttercup.
Yeah, I'm glad he was very concise, well delivered, had some jokes in there that I don't know if I included in the reaction video. I did laugh at them. They were some good ones, but very pointed, factually based. I was expecting there would be things in here like, I don't know about that one, because I've watched other videos that they've made in my area of expertise where I'm like, I don't know about that. Some of that's good, but there wasn't really much of that in this video. So yeah, I commend them for doing this. I will say this problem's been around for the entire running of the show, and the show has been on for years, right? I think 6, 7, 8 years. And, God bless them. They're doing a lot of great things with this show in a lot of topics, right? But it just shows like our priority list. Right? Think about all the things that they've covered before they covered this issue, or maybe they've covered it before. Anyway, I don't want to put them down. I'm just saying it's a reflection of us. If we valued it more, then John Oliver would have talked about it earlier. Our politicians would be allocating more money. People would be talking about it more. So we need to change us. We are the system. The system reflects our values. Our government reflects our values, our voting behaviors. When we talk about mental health, a lot of people think, like crazy people, right? Schizophrenic people. But a lot of times what I'm talking about when I'm talking about therapy services, and I try to stay away from the word mental health and the word mental illness because I think that can confuse people. There's a lot of people of all ages that would absolutely benefit from therapy that don't have necessarily a strong diagnosis or any diagnosis at all. And if you met these individuals, and you might be one of them, you would agree that they do deserve therapy and that it is a social good and a societal good if that individual were to get the help that they needed. For example, if someone was having repeated difficult relationships or abusive. So let me just use that. Being abusive is not a diagnosable issue in the DSM. So if you have an abusive person and they don't qualify for any DSM diagnosis, they do not qualify for medically necessary treatment. we need to change that, right? We don't want to just rely on diagnoses and medical necessity or how it's defined to define who gets services, even when it's hard to get services anyway, right? Just because you have a medically necessary diagnosis like anxiety or depression, it's still hard to get services, but particularly if you don't have a diagnosis that is considered medically necessary for insurance to pay for it, right? And there's a lot of issues like that. You have relational traumas, but you're not diagnosable, and those individuals might not qualify. Now, this doesn't mean that people can't find therapists. Many people do. But even when they don't have a job and they have medical coupons, they can go to mental health agencies. A lot of people are getting services. A lot of people are getting therapy. When I worked at an agency, I would have clients for years. It was all free for them. And so there's a lot of really good things happening, and a lot of that is paid for by the government, state and federal. So a lot of good things are happening. A lot of money is being allocated. We just need to increase it, double it, triple it, quadruple it. That's all you got to do is just pass that bill, increase those funds, and let the industry work itself out, because it probably will. And so it's not that hard. Well, that was interesting. Thanks for suggesting I watch this. And everyone out there, please take care of yourself because you deserve it. You really, really do.